All right, so I just want to welcome you all to the Hubert Department of Global Health webinar. My name is Wendy Hicks, and I'm the Assistant Director of Recruitment and Admissions, and I'm going to turn it over to Ms. Teresa Nash, who will begin introductions. Thank you all for joining us, and we're excited. Here we go.
Hello, everybody. I hope you're well. I hope you're enjoying your lunches as you listen to us today. And thank you so much for taking time out of your day to learn a little bit more about the Hubert Department of Global Health. My name is Teresa Nash. I'm the second picture there, and I'm the Associate Director of Academic Programs in the Department of Global Health. I've been with Emory since 2002, so I've had my 16th year anniversary here. And my goal is to retire from Emory. I absolutely love everything about the university and especially love the Global Health Department. It has a really fond place in my heart. Flavia Travin is the other associate director, and she is home with a child who has the flu. I don't know what's going on in your cities, but we are completely inundated with cases of the flu here. So I hope you guys are staying healthy. The real stars of the show today are the 4 students that are joining me today. I'm going to have them quickly introduce themselves now, and then you're going to have a chance to ask them questions and hear a lot more about their perceptions of the program a little bit later in the hour. Binta, do you want to start?
Hi, everyone. My name is Binta Sise, and I'm a second-year student, and my concentration is in community health and development.
Hi, everybody. My name is Molly Leinebarker. I'm a second-year student as well with a concentration in public health and nutrition, and I'm looking forward to talking to you guys today.
Hi, everybody. My name is Olivia Page, and I'm in the Sexual and Reproductive Health and Population Studies concentration, and looking forward to speaking with you all later.
Hi, everyone. My name is Madhu Govindu. I'm a second-year student in the Infectious Diseases concentration, and thank you for joining us today.
All right, everyone. And as a note, please make sure that if you come up with a question while we're presenting, please feel free to type it in so that when we get to the question and answer session, we'll be able to jump right in and answer the questions as they were typed in. All right, here we go.
Okay, very good. Let's start just by talking a little bit about the Department of Global Health. Hubert Department of Global Health is one of the most competitive departments to get into here at Rollins. You will be joining a cohort of about 100 incoming students. That's our goal, is to have a starting class size of about 100. So you will join second years. We've got 120 second years, so that makes our total student population here about 220 students. The average age, as you see, is 27 this year. We have students that range in ages from 21 to 45. As you'll notice from our panel, about 80% of our students are women. The other 20% or so are male, and that's really consistent across schools of public health. They tend to attract more women than men. In global health, 21% of our students are international. We have 5 fellowship programs, and these fellowship programs are brought to bring people all over the United States to study here in the Hubert Department of Global Health, to gain skills to go back and do their great work in public health around the globe. These students are great mentors for you in the classroom, and currently we have 5 different fellowship programs here. We've got the Humphrey Fellowship Program. We've got a CHE Fellow, which is the Center for Humanitarian Emergencies. We've got King Abdullah Fellows from Saudi Arabia, Faggy Fellows, as well as Fogarty Fellows. Now before we turn this slide, I just wanted to talk to you a little bit about our faculty. In the Hubert Department of Global Health, we have about 40 primary faculty who work across disciplines. So as you see, we have 4 concentrations, and these folks work in everything from infectious disease to reproductive health to measurement and metrics, demography, gender equity, public health nutrition. So we'll go into a lot more detail about their areas of expertise shortly. Other really important part of our program is that we have over 120 adjunct faculty. And these faculty, most of them work here in the United States in agencies such as CDC, CARE, USAID, and others. And they serve as mentors for you. You can find real positions, job opportunities with them, as well as they will mentor you on thesis and practicum. So they are very much resources for you to use. All right, let me tell you just a little bit about our curriculum. We have 81 different courses that GH faculty lead here, so we offer more courses at the school than any other department. Most of our courses focus on skills and methods because, as you probably already know or will learn soon, the real advantage that you have in getting an MPH degree is the skill set that you develop while you're there. So while the topical areas are very exciting to you guys, and students will talk about their work in sexual and reproductive health, infectious disease, public health, nutrition, and community health and development, the skills are what really will make you marketable when you leave. So we focus a lot of our time on helping to advise you on what specific skills will make you most competitive given your career trajectory. All of our students here are required to complete a practicum. As you know, an MPH is a practitioner-based degree. So the practice component of the degree is your global health practicum. It's 200 to 400 hours working either in a low-resource country or here in the United States. We've listed just a few of the countries that our students have had practicums in over the last couple of years. And I'll let you know, a really unique part of this program is that most students get funding to pursue these practicums. And our students are going to talk to you about that in just a little bit. So if your goal is to accumulate some really important practice-based experiences in low-resource settings, that's absolutely doable while you're here. And in fact, we will fund you to do so. And students are very, very excited about that. The real award program is kind of like college work study, except at a graduate level. And that's when the school subsidizes about half of your check, and then the hiring agency pays the other half. So essentially what it means is you are skilled, cheap labor. So it's really easy to get in at places like CDC and others when they only have to pay $6 an hour to hire you. So 80% of our students who got the real award had public health positions, and these are stats from this spring. And in order to be eligible for real, all you have to do is fill out the FAFSA. But please fill it out early, because real award money is limited. And if you fill out the FAFSA late, you may not be eligible for that award. So please, if I could give you one piece of advice as far as, being eligible for the most financial aid you can, you need to get your FAFSA in just as soon as you can. That's very significant. Wanted to talk to you just briefly about postgraduate employment. Our biggest hiring sector is the U.S. government. They hire over 30% of our graduates, and most of this, our number one agency that hires our graduates is CDC. 20% of our students go to work in nonprofits or NGOs. 11% work in a hospital or healthcare delivery setting. 17% work in a university setting or with a research institute, and you can read the other statistics there. And we can talk about that in a little bit. Okay, let me tell you some basics about our program. Our curriculum, as I said earlier, really combines methodology or skill sets with subject-specific knowledge. And everything you're taught through a lens of global public health. So the program is meant to be global. You will not be learning just U.S. public health. You will be learning always from a global health perspective. We are a 32 credit hour degree program, although I'll tell you a caveat of our program, and if you haven't figured out this yet, let me be the first to tell you, you are charged per semester as opposed to per credit hour. And what that means in very tangible terms is even though 42 credits are required to graduate, our average student is graduating with in excess of 50 credits. So it's a really good way to stretch your tuition dollar because you are charged a flat fee per semester. And for students, that means you guys can graduate, or you can register for between 9 and 18 credits each semester for the same tuition amount. So students are able to pursue and complete certificate programs without incurring any additional tuition expense. So that is significant, and I would suggest as you're considering programs, you look at the tuition structure, and just know that if you're going with a school that has a flat fee, that's really can be used as a huge advantage to you. As I mentioned earlier, our practicum requirement is between 200 and 400 hours. You can do a practicum, a domestic-based practicum, or an international-based practicum. And about 30% of our students do domestic practicums because they're interested in working with CDC or other local organizations. Our program does require the completion of a thesis project, and our graduates say that that's one of the most valuable projects that they do while in graduate school, and it makes them more competitive in the job market. It helps to refine their research skills. So there's a lot of good reasons to select a program that requires a thesis. And as I've said earlier, we are a program that is focused on methodology and skills. We'll talk about that a little bit more in our next slide. One thing that makes the Hubert Department of Global Health unique is that we do have 4 areas of concentration. So students can specialize in one of the 4 areas listed on the PowerPoint: infectious disease, sexual and reproductive health, and population studies, community health development, and public health nutrition. We did select one student from each of these 4 concentrations. So if you have specific questions for these concentrations, feel free to ask, and we'll get to that soon enough. Okay, I've talked a lot about skills. What are some of the most common skills that students seek to gain while they're here? Take a look. Students are very interested in getting mixed methods, so they want to study quantitative as well as qualitative research skills, and this is very doable and really is the norm with global health students. Most of our students realize that if you work in public health, you have to be able to evaluate the programs that you are conducting, so monitoring and evaluation is super important. Survey research design is another one. Everything you do has to be based on evidence, and in order to understand the evidence, you need to be able to design a survey, design a study to evaluate. Advanced epi and bio skills are the norm. It's really hard to finish the program without taking some advanced epi and bios classes, so that is the norm for our students. Surveillance is also critical, and many of our students take public health surveillance. Management courses are critical for those of you who want to work in community health and development and other concentrations. Let me take a quick moment here to tell you another unique quality in our program, which is, let's say you're really interested in management. You can take classes anywhere on the university campus without incurring additional tuition expense. So students that are very interested in management are able to take classes at our business school, the Gazweta Business School, to add to their skill set. And although these classes support their MPH's electives, they don't incur additional tuition. Similarly, students are able to take undergraduate language courses at our medical school, our School of Nursing. So all of these can be added to your skill set. And just a couple more classes. Informatics classes like GIS are super critical and important. Implementation science, how to translate research into practice, that's implementation science. Those skills are important, as well as we have a couple of applied labs, wet labs here, if that's something that you're interested in. As you probably already realize, Rollins does also offer school certificate programs. So these are not meant to be standalone certificates. You can only earn these if you're a part of an MPH program. So if you want to be more specialized, you want to set yourself apart from other graduates, you might consider completing a school certificate program concurrent with your NPH. These are programs that you learn more about at orientation. So if any of these sound interesting to you, feel free to search our website. You can get information. There's contact information there. And many of the students in the room have completed one of these certificates, so we can entertain questions about those shortly. I'd like to highlight for just a minute, let's see what time it is, make sure I'm not getting I'd like to highlight just one of our certificate programs that's my baby, and that is the Certificate in Complex Humanitarian Emergencies. And let me just talk to you for a minute about that certificate as an example of one of the certificate programs. That certificate was rolled out in 2010, and it comes from a long ongoing collaboration that we have had with a branch at CDC called the International Refugee Response Branch. This branch has two missions. One mission is to respond to complex humanitarian emergencies around the world, and the second mission is to train people that want to be the next wave of responders. They've had a long relationship with us here at Rollins, and back in 2008, they let us know they wanted to start a certificate program with us. So we crafted that certificate by and large based on the skills that of the branch. So the folks at the branch have adjunct appointments here at Rollins. They teach 8 different classes that focus on humanitarian emergencies, and they are available to mentor you guys through practicum opportunities as well as research projects. So that's just one example of one of the certificate programs you will have access to while here at Rollins. Okay, let me talk about one of our students just as an example to let you know what a student profile looks like. This is a student of mine. His name is Skander Zah. Skander graduated last May, and Skander came from to us from Tunisia. He was an international student with a huge interest in the area of humanitarian emergency response. Skander was able to complete his MPH with the Global Health Department, focusing on infectious disease. He also completed the Complex Humanitarian Emergency Certificate Program, and he worked with SORT. That is a popular student organization that stands for Student Outreach and Response Team. And SORT students work closely with CDC and other organizations that actually need assistance responding to emergencies. So one year they did a social mapping program to try to identify who was still in need of assistance in a tsunami. That was one year that I remember. So Skander was a part of the SORT organization. His practicum, he worked with WHO, and he worked at the Syrian border with WHO, and he received 2 university grants to support his summer studies. He was a recipient of the Jiffy Award, which is Global Field Experience, as well as the Global Health Initiative Award. So he got full funding to go and do his research in Turkey. His deliverable for that practicum is he wrote the first mortality and morbidity report in the region since the refugee crisis began there, and he wrote that for WHO. And he also designed a health information system to strengthen the surveillance tools that WHO used in that region. So those were the deliverables for his practicum. He came back here too, and he wrote a thesis, which was a mental health survey of Serbian refugees that have resettled in Atlanta. So he continued that work here in Atlanta, and he is now working with IRC in New York City. So that's just one example of a student and how he was able to utilize the different programs here to really further himself in his career, which is to work with and do humanitarian emergency response work. Okay, I'm going to turn this over to the students since they're who you're really here to listen to. And they're going to talk to you just a little bit about themselves, maybe focus on their practicum or thesis work or other opportunities they've had while here at Rollins, and maybe say a little bit about what made Rollins unique to you. And let's start with Binta today.
Hi, everyone. I'm glad you guys all joined us. Like I said, my name is Binta Cisse. I graduated from Georgetown University in 2014, and I majored in international health there. I took a year off, and I taught at a before and after care program. Applied to Emory, got in, was really excited. I definitely chose Emory because it's in Atlanta and it wasn't cold like Boston. But definitely the opportunities in the city of Atlanta, partnerships with CDC, CARE, and a lot of other public health organizations, but especially for the Global Health Department and their program. It's a top-ranked program, and they just had everything I needed and wanted, so it seemed like a perfect fit. And so before I came to Rollins, I actually deferred my acceptance, and I got a fellowship, and I went to Tanzania, learned Swahili, got a little more international experience before starting my MPH. And then I had my first year, which was pretty successful, and I had my summer practicum. I went to the Virgin Islands, and I worked with their Department of Health, and we had a partnership with the CDC, and we implemented a CASPER survey, which is basically a rapid response survey that's usually used in emergency situations. And so we did a knowledge, attitudes, and practices survey on Zika virus on the in the territory, and that led to my thesis, which I'm now doing a systematic literature review on strategic responses to Zika virus in American territories. So basically focusing on the research that I did do in the Virgin Islands and also in Puerto Rico. So that's a quick tidbit. And I am in the community health and development concentration. And the reason I chose that concentration, I'm kind of all over the place with my interest. I was a little interested in all of them. And I feel like community health and development kind of is more so of an umbrella concentration. You can kind of get involved in a lot of different things. I didn't do a certificate. And if I did, I would have done the CHE certificate, which is the Complex Humanitarian Emergencies certificate, especially after the experience I had in the Virgin Islands and doing my practicum. But like Teresa said, there's plenty of classes and things that you can take. So I ended up taking a winter break course on planning for emergency responses, which I found to be very helpful. And I know I had something else to say. I can't quite remember. But yeah, if I remember, I'll let you guys know.
Hi, everybody. My name is Molly Leinenbarger. I'm a second year, and I'm pursuing the public nutrition concentration. I went to Duke University and got a degree in neuroscience, and then I spent a year working in Guatemala and Belize in a free health clinic and working with community health workers. And I really got to appreciate the role of public health and what public health can do to improve the lives of people all over the world. So I decided to apply to MPH programs. I was really, really hoping to get into Rollins. I was really excited about it for a couple of reasons. Like Binta was saying, being here in Atlanta is just the best place that you can be to get your MPH with all of the opportunities that are around the CDC with CARE, the Task Force for Global Health. There are so many organizations that you can work with. But also, the one thing I really like about Rollins is the WASH certificates, the Water, Sanitation, and Hygiene certificate, and the Center for Global Safe WASH here at Rollins is really an incredible opportunity that I didn't see at a lot of other schools, and I knew that I wanted to work on that, and it's been a great experience so far. So here at Rollins, I've been working for the same professor for 3 semesters now, and I work on 2 projects with them. I'm working on a project in Kenya and a project in Ethiopia. I went to Kenya over the summer with that project to do an evaluation of a maternal and baby nutrition and WASH project. And right now I'm doing my thesis, which is a qualitative evaluation of the data that I collected over the summer.
Fantastic. Thank you.
I do remember what I was going to say. Like Teresa said, definitely take advantage of the flat tuition rate. I am taking Arabic in the undergraduate course, and the undergraduate campus. And so, I mean, although that schedule is kind of tight, definitely being able to take those classes like throughout the school, especially since I didn't have a certificate program. So getting to dibble and dabble in all the different areas. So I definitely took like a nutrition class, a global elimination of malnutrition class last semester, since I had a little bit of interest in nutrition, and then being able to take a language course. So I would definitely recommend taking advantage of that flat tuition rate. It is a great deal.
Hi, everyone. My name is Olivia Page. I'm a second year, and I'm in the Sexual and Reproductive Health and Population Studies tract. It's kind of a mouthful. SRH, it can be abbreviated to just SRH. So I came from Rollins straight from undergrad, and I was a sociology and anthropology major there. I did some work with sexual and reproductive health, and my interest is sexual and reproductive health and complex humanitarian emergencies. And so I've been able to explore that interest through my current real position with the Emergency Response and Recovery Branch and the Center for Global Health. And that's been really interesting. I've been working on a project with UNICEF there. And I think that the REAL program is something that's very unique to Rollins and something that I actually didn't get REAL my first year, but I was able to obtain it my second year. And like Teresa said, all you have to do is fill out your FAFSA and fill it out soon, and then you're eligible. So as someone who didn't get it the first year and got it the second year, I can say it's been a really great experience for me, and I've found it to be really helpful in my Rollins career.
Hey everyone, my name is Madhu Govindu. I'm a second year in the infectious disease concentration. So I came to Emory from the University of Texas at Austin. I did my undergraduate in human biology and actually took 2 years off after I graduated, and I worked as an ER scribe because at the time my goal was to go to medical school. But during my time as a scribe, I kind of got to experience firsthand the lack of public health knowledge and lack of public health education in our population, and that kind of really piqued my interest in the public health field. And so I went ahead and applied for my master's, and I was very lucky that I got into Emory University because it's really been one of the best experiences I've had. I've had the chance to work with amazing faculty. This past summer, I did my practicum in India looking at WASH in the context of child malnutrition in India. And I'm actually going to be using the work that I did for my practicum and tying that into my thesis as well, which is examining the incidence and prevalence and the determinants of severe acute malnutrition and stunting among children in Bihar, India. And I think more than anything, what I'm taking away from Rollins is just the skills that I've gained. Obviously the skills that I've gained, but also the experiences I've had with my colleagues, with my students, with faculty. It really has been one of the best experiences so far. So I hope to continue that with my future plans.
Wonderful. Thank you all very, very much. It always just blows my mind when I hear students talk about the scope of their experiences. It's pretty neat. I think we're ready to begin taking some of your questions. So it looks like we've got some typed in. Feel free to keep typing, and let's see where to start.
Just to confirm, undergraduate language classes are included in the semester tuition.
Yes, that's correct. Let me say just a bit more, or did you want to say more?
Oh, I was just going to say that all other classes are also included. And so with the SRH, we have classes offered in the nursing school. Those are included. You can do an interdisciplinary class or classes in the business school. Those will also be included.
Also gym classes.
Yeah.
I just came back from one, so.
And for those, did you have to apply to the school as a non-degree seeking student, or were you able to just register for them?
You're usually able to just register. Sometimes you need to get some confirmation from the academic, the professors maybe, but other than that, you can just register.
And usually every semester, Teresa and Flavia will send out a list of classes that are available in the different schools, the law school, the business school, and you'll be able to see the courses that are offered. You'll be able to contact the professors, and you maybe even have access to the syllabi before you take the class to see if it's something that you're interested in. But yeah, most of the classes are definitely covered included in the tuition.
All right, perfect. Thank you. Elise would like to know, can any of the students talk about the process of finding a practicum and the support or help Emory provides?
I could talk about that. So Emory in the fall, they offer a practicum fair. So we have a lot of organizations come out and they have a list of some of their practicum opportunities that we could use to complete our practicums. But that's not the only place. You could definitely look online, different organizations. I know plenty of students who didn't go through Emory to get their practicums, but Emory does provide that guidance. And that's how I got my practicum to work in the Virgin Islands. So I attended the practicum affair, and it was actually students from the year before who represented the Virgin Islands. And I ended up doing that this year. So it was a good way to shop around and see what opportunities are out there. And then in terms of funding, there's the Jiffy. I know Teresa talked about that, the Global Field Experience. And I would highly recommend taking it was a grant management class. I don't remember the exact title, but it was
proposal development.
Proposal development. Yes, it was extremely helpful in writing your proposal to get the Jiffy funding. And I know it was only a half semester class, so I know a lot of students, took the class. It lined up well with the deadline for the Jiffy, and it's a really good way to prepare you. I also use the things from the proposal development class. I actually have a nonprofit with my cousin, and I definitely use everything in that class to submit a proposal. I actually have to redo one today, so the class is helpful in more ways than one. And then I also got funding from the Department of Health, so a lot of times they will give you stipends and such, so I got a stipend. And then I also applied to the Boozer Scholarship. It was another one, just check your emails. They're always sending things out. And I applied and got that as well. So definitely I had enough funding to sustain me over the summer.
Another option is the Emory Global Health Institute offers interdisciplinary practicums with students from different disciplines throughout Emory, and they offer funding for their practicums. That's how I found my practicum, working on mental health and reproductive health in Haiti.
And another thing is, I mentioned this earlier, but your colleagues in the program are also an amazing resource, because that's how I found my practicum. So one of my fellow global health students was preparing for his practicum, and one of the faculty advisors on his practicum was looking for someone for an opportunity in India to work on a study there. And so he connected me with her, and through that connection, I was able to secure my practicum in India, and that practicum is now turned into my thesis. So really, utilizing your fellow colleagues is also a great way to go, and one of the benefits of Emory that I did not expect, and I was very pleasantly surprised.
I also just wanted to add that one thing unique about the Hubert Department of Global Health is all of our faculty are research faculty, and all of them are involved with research across the globe. So, just with the resources of our faculty alone, there's probably plenty of practicum opportunities, but we certainly do work directly with students to offer a whole lot more support. And the fall practicum fair that we mentioned earlier is just for global students. So it's a program that our department puts on every year. We have about 100 posted opportunities that students can choose from. And again, many students find practicums in other ways besides the practicum fair.
Okay, thank you. And so we do have a question regarding the REAL program. And so, give me 1 second, sorry about that. When do you find out if you are a REAL award recipient? So that can actually vary whether you're going into the fall or spring semester. You all can share when you all did. How many people did REAL? Anybody? Okay, so
All of them.
All of you? Okay, so you can kind of share when you received and let them know how early you applied as well.
If you don't remember. I can't recall.
Okay, that's okay.
Yeah.
I applied to FAFSA like as early as I could my second time around to make sure that I got REAL, and I think I was notified when you get your financial aid package, it comes out of whether you receive REAL or not, and that you can find through Opus, which is our online kind of information system.
Okay, so sorry. All right, so thanks everyone for sharing. So you have an interest in health policy, and are there any ways that you can explore this interest academically? If so, could you provide some examples? So is this that you're interested in additionally exploring health policy while in global health, or are you specifically interested in the health policy department?
I think even in, like we mentioned, you can take classes. If we can take it in undergraduate business school, you can definitely take classes across the board. We do have a core requirement where you have to take like the basic level of health policy and management, but all those courses are usually open, especially if you talk to the professors and things like that. So you definitely have the opportunity to explore the health policy side of things, even if you are a global health student.
Yes, very good. And also, just to let you know, if you are actually interested in the department, we do have all of the departmental webinars will be posted on our Rollins YouTube page, which can be found on our admissions page. So please feel free to see their webinar, which occurred last week, and so you'll be able to see that as well. All right.
Living in Atlanta.
Okay, perfect. Thank you. Sorry. So one student would like to know, what is it like living in Atlanta?
I'm from Atlanta originally, so I can kind of speak to this one. I think that, living in Atlanta is really interesting as a global health person, particularly because of the refugee community located really close to our school, actually. We have several classes that focus on, we have the Clark program, which you can look up online. This is a program that focuses on working with the refugee community, and there's a lot of Emory programs that work with refugee populations in Clarkston, which is kind of really cool. I think something that's really unique to Atlanta's population. Yeah.
I think something, as someone who's not originally from Atlanta, I think something that's really unique about Atlanta is that you're right near this huge city that has all of these opportunities. There's baseball, there's basketball, there's museums, there's concerts. Everything that you could want in a big city is right there. And then you can live there, or you can live out here closer to Emory. We're like a little bit outside of downtown Atlanta. So I don't feel like I live in downtown Atlanta. And I like that part too. But if you want to live downtown, if you want to have that feeling, you can also live there and commute to Emory. You get a little bit of both.
And as somebody who's not from Atlanta and from the country, that's one of the cool things about the area of Atlanta. Everybody kind of groups everything together as Atlanta, but as she was mentioning, we have different little areas like Decatur, Northwood Hills, Atlanta itself, and so it gives you a chance to really be in a place that you feel comfortable in. So for me, I like seeing grass and people jogging, things of that nature. So I've settled in somewhere that's kind of close to Emory, but it's a little bit out because I like having a yard. But like she said, there's students who love being in the concrete jungle. So downtown Atlanta is where they settle. So there's something for everyone. They also have awesome areas where different cultures are residing. And so you can find like specific foods and things of that nature that you like. So Atlanta definitely has something for everyone.
And for those of you who haven't been to the university, hopefully you'll be joining us at Visit Emory. But I just wanted to let you know that Decatur is a very university. It has a university town feeling to it. I'm from Michigan, and it feels to me like University of Michigan, like Ann Arbor. It's a very friendly university town and really a special place.
Atlanta is also becoming kind of a young city with a lot of younger people moving to the city. I've seen a lot of growth just in the time that I've lived here. So that's something that's kind of exciting.
And if you don't know, Rollins is literally located right next door to CDC. If you look out the window, you see the CDC campus, which is literally a stone's throw from our building.
And I would be remiss if I did not throw in that we're also the public health capital of the world. So, all right. So could we talk about the percentage of students from the department who go on to further education, such as the MD or PhD programs?
Yeah, I mean, I can't give stats because I don't have them, but certainly a good handful of our students apply to medical school after they finish here. And then we always have students that come to us with a medical degree already. And we'll have a couple of students completing a dual degree program while they're here doing MD, MPH degree. So there's a logical connection between clinical degrees and an MPH. So certainly that's a relationship that exists. And I think, if I remember correctly, about 12% of our students go on post MPH to complete another degree immediately. So that's the first thing they do after they get out of here. Anything else you guys want to add on that?
I would just like to say a lot of times for statistics, the career services, they have some really awesome statistics on their website as well. And it also shows you the percentage of students by cohort, the graduation year, where they're going immediately, then like I think 1 or 2 years out, and then there's one more. So that's a great place, as well as our admissions website. It can give you some statistics as well, if those are some things that you're interested in. But please keep in mind every year is different, so percentages change based off of cohort and student population.
I see a question that I'm going to pick up on, and do you mind scrolling down? I think we've got a whole lot more questions there. I'm going to talk about faculty advisors because somebody asked a question about faculty advisors. Next year, I believe we're going to have a choice for you guys. Right now, this year, we're piloting some learning communities where we have a group of 12 students with similar academic interests, and they are paired with 2 faculty advisors and 1 second-year mentor, and they meet on a bi-weekly basis to provide academic advisement and to help stitch them into the Emory community. So you will likely have a choice between joining a peer learning community that is faculty-led or having a one-on-one faculty advisor. We take care of these assignments over the summer, so you will hear from us early summer to get some of your feedback on how you would like advisement, whether you do better in a group setting or whether you would like a one-on-one advisor. So more details to come on that.
So we have one student that wants to know how easy or difficult is it to secure a public health related job if you don't get real?
I didn't get real my first year, and I was able to find a public health job online. We have a program where real opportunities and non-real student work opportunities come in, and you can apply via online. And so I was able to find one through that. So it's definitely possible. So if you don't get real your first year, it's certainly possible to find a job. And there's also plenty of opportunities to work on campus with different projects and things. So I wouldn't be worried about that.
Great, thank you. Well, this is a great question. So for students, and Teresa, when do you pick your faculty advisor and what is that process? How frequently do students meet with them?
I think we just addressed that. As far as the only piece I didn't address is how frequently do you meet with the individual advisor. If you select to have an individual advisor, then you can meet with them as often or as rarely as you prefer. Typically, students at a minimum meet with them to talk about course selection prior to registration for the future semester. And as far as the learning community groups, those typically meet every other week for the first year.
Sorry about the duplicate question. Are there classes or resources for learning less commonly spoken languages for students who want to do international practicums?
I know with the undergraduate community, they have student or independent language study or something like that. I think the acronym is SILS. We like acronyms here. And so that might be too specific of a language, but I know for Swahili, like you could do that and have independent language partners. And if you have another undergrad, it's particularly for undergraduates. So if you have another student who's in the undergraduate program, you get like a discounted rate. So you end up paying like $300 for a whole year or semester. I can't remember, but the acronym is SILS. So if you look that up, it's possible that you could find something for that.
And are any of these opportunities open or relevant to Global EPI students?
Any of these opportunities. Global EPI students kind of have their feet in two departments. They have their feet in the EPI department and their feet in the global health department. Your home department as a global EPI student is epidemiology as opposed to global health. So your mentorship primarily is coming from epidemiology. However, we welcome any students at Rollins to receive mentorship and participate in classes out of the Global Health Department.
Okay, looks like we have a shout out to you over there. That's awesome. So someone would like to know, how is the housing search?
So the housing search, I actually used several different tools for my housing search. So the first one is, I think something that you may already be familiar with, is I think it's called the Emory Off-Campus Housing Locator. It's the website. I'm not exactly sure what the exact name is.
Housing Finder.
Housing Finder, there you go. And so that's the one I started using at first, and I was able to find my first roommate on there. And then we were looking for a apartment for 3 people, so I found the second one on the Emory Facebook page. So Rollins has a Facebook page for each of the cohorts. And so I found the third roommate on the 2018 Facebook page. And so we got together. The first roommate had already been looking here. She had visited Emory in Atlanta, so she had already had a chance to look at some apartments. And so we kind of went from there based on her videos and things like that. And there's a lot of housing near Emory, especially in the North Druid Hills area. I feel like most students live in that area. But yeah, within, I want to say, a 2 to 3 mile radius from Emory, you'll find tons of apartments. lots of students that live there. So, and there's a lot of running trails near Emory and things like that. So, in terms of that, it's a pretty student-friendly area.
Okay, we have a lot more questions, so we're going to try to give a little bit of abbreviated answers to try to get to all of you. For international students, how likely is it that you could be eligible for OPT? Very likely. I just approved 2 OPT applications yesterday. That's not so difficult. How would you describe your relationship with professors? Can any of you speak to specific research projects or things that you've done with faculty?
I think there's lots of opportunities for students to work closely with professors. Our class size, once you get into kind of some of the more in-depth classes, are pretty small. And so students have opportunities to work with their advisors or just professors that they share an interest with. And I think a lot of students end up doing practicums with professors as well.
And to add on to Olivia said, you also have the opportunity to work as a TA for professors. And I've TA'd for 4 different professors and have had the opportunity to build pretty close relationships with them. So in addition to working with faculty on your thesis or your practicum, TA positions or research assistant positions are also great ways to build relationships with faculty members.
That's something that I feel like is really unique to Rollins, is the professor's willingness to kind of reach out to students and kind of be there to work with students in their interest areas is really, the faculty are really just great in the Global Health Department.
Just one little caveat. Currently, Global Health does not have a PhD program. We're due to roll one out in 2019. But at this point, master's students are our faculty's only resource. So that means they come to you for everything. If you're applying to a program that has a PhD program, the attention first goes to PhD students, but you guys have the full attention of our faculty. Now, we have a student that asks, from your experience, are most of the students in your classes straight out of undergraduate, or do they have work experience? I'd say like 50-50.
Yeah, kind of what Binta was saying. It's a pretty good mix. You'll have some students that are straight out, and then some students that have come back from the Peace Corps, or some students that have had a completely different career for the last 10, 20 years and then come back to do their MPH. So you really do find a good mix of both students that's straight out of undergrad and students that have some work experience. And plus, kind of what Teresa hinted at earlier, with all the fellows that we have, obviously most of the fellows, if not all actually, are working professionals in the public health field and in their respective fields. So yeah, we have a good mix.
Okay, very good. We have a student that asked when they should expect to hear back from financial aid and about merit-based scholarship money.
All right, so currently merit-based review has begun by the departments and admissions. So you should look to hear about something by the end of February, in March, beginning of March, because April the 15th is your deposit and acceptance deadline. So they're working to get those out as soon as possible. So be looking for it, probably by the end of the month or next month, because in April you have to deposit and have accepted your admission decision.
Okay, very good. Going on. What's most compelling here?
Concentration.
Okay, very good.
Yeah, so we had a question about when do students select their concentrations, and I think that's within the first month of being a student at Rollins.
Yeah, I think our deadline for our cohort was, I think, end of September or early October.
Yeah.
So you do have a chance to, when you register for your classes for your first semester, to kind of take a couple classes extra that you're interested in and see if, that's a subject area that you'd like to pursue as a concentration.
We've got a question about having a car on campus. How necessary is that?
Not necessary.
Yeah, I don't have a car, but I live on a shuttle route, so it's easy for me to get back and forth. But Atlanta is definitely a car city, so if you do have a car, that would be preferable. But if you don't, you can definitely get around, like Uber. I haven't used the MARTA, but I heard it's all right.
Yeah.
But definitely, if you live by one of the shuttle routes, you'll be fine getting to campus.
And to add on to what Binta was saying, I do have a car, but in terms of using the MARTA, if you're not from Atlanta and you want to go to you want to fly out to see your family, MARTA is actually a great way to go to the airport. I just hop on a train and I'm at the airport and my car stays safe in my apartment. And so in that way, MARTA is actually pretty nice here, getting around. So
I'll just say that all student housing is on our shuttle line, and parking is very expensive on campus. So you got to note that in your budget. I know I pay about $60 a month for parking, so I think students probably pay somewhere around that. You don't need a car to go to school here. We have a question clarifying real again, so I think Wendy is going to speak to that. The question is, you can't apply for real until you receive your financial aid package through OPUS, correct?
So, and I do apologize again for that. As a domestic student, it's a part of your package. So if you are in the first, we'll just say first 50 students, you will be considered, and it would come in your OPUS, show up in your OPUS as a award. So international students, it's different because you would have to apply for that after your first semester. So you'd be here for a full semester and then apply to real. But for domestic students, that would be something that's considered and would be offered as your in your financial aid package, and you can.
So there's not an additional application
Yes.
for real for domestic students. You
only.
just need to apply doing your FAFSA,
Yeah.
which is just the general financial aid, and then if you are awarded, it will show up on OPUS.
Yes.
I hope that clarifies.
And I think FAFSA opens October now instead of January. So
yeah, that's great.
I literally, my FAFSA rolled over from the previous year, so I applied because I was one of the students that also didn't get it my first semester. I got it, or my first year, I got it my second year. So yeah, I submitted my application that night that FAFSA opened, and I got real the second year. So it's definitely doable even if you don't get it your first year.
Looks like we have 2 more questions. Are classes held throughout the day, or are most of them during the day and the evening? I'll just say that classes are scheduled from 8 until 6 p.m. Most classes are between 10 and 1, but certainly students could have classes as late. I think some labs go until 7 p.m. So that's the answer to that. And then the second question might be related. Is it doable to work, take more than 9 credit hours research, get involved in the community as a student? Students can speak to this, but the majority of our students do work between 10 and 15, sometimes 20 hours a day, so a week. Sorry.
Yeah, sorry, definitely a week. But I think Rollins students do try to take on like a lot of different things during their time here to kind of make the most of the 2 years that you have. It's certainly possible. You know yourself better than anyone else, so you'll have a good idea of what you can handle time management wise. But I think it is possible, and just always remember that you're a student first. Mm-hmm. So that comes first.
We're going to put up the slide with our contact information now in case anybody has questions. I think we've about run out of time at this point. And let's just get back to, it's the first slide. See if we can do it. There you go. Very good. So here's contact information for everybody that was present today at the webinar. And could you remind us where this will be posted?
Yes, it is going to be on our YouTube page. If you will give me 1 second, I can pull that for you. I do apologize. But it's our RSPH, which is the Rollins School of Public Health YouTube page. And I'll give you the link to that. Okay, so that can be found. Sorry, y'all. You're gonna go to youtube.com. See, why is this not? Sorry, it's not giving me the full link. Okay, sorry. YouTube.com, and you're gonna do a /user/RSPH admissions/videos, and so that'll bring up all of the videos from our current and past webinars. And so again, that's youtube.com/user/RSPH admissions/videos.
Thank you very much for your time today, and we hope to meet a lot of you at Visit Emory in March.
Thank you.
Bye, guys.
Bye. Thank you.